You are welcome to my channel. Today I'll be addressing post-renal causes of renal failure. Right here, I have published pre-renal causes, renal causes of renal failure. Today is about post-renal causes of renal failure. Okay, when it is about post-renal causes of renal failure, it means that the kidney has functioned well, produced or filtered appropriately, whatever the waste product is being sent out through ureter to the bladder, but it's not getting out through the urethra. So what could be the problem? More than one mechanism can be involved here. It could be outflow obstruction, neurogenic impairment, inefficient detrusor muscle, certain medications, infections, or trauma. Now, acute urinary retention will be another entity here, and there will be a separate presentation on that. Acute urinary retention is the commonest urological emergency because urine is retained. Okay, this is very rare in women, more in men. Male to female ratio is 13:1, and this problem will increase with age. Okay, post-renal causes of renal failure will be all due to obstruction at different anatomical structures in the renal system. Here, about kidney, it could be as a result of nephrolithiasis, that is kidney stones, cancer affecting the kidney, or papillary blockage with slough. Could be as a result of problem with ureter. Remember, ureter will connect the kidney to the bladder, and that could be the result of ureteric stones, cancer affecting the ureter or compressing it, tumors from adjacent structures compressing, fibrosis of retroperitoneal organs, urinary tract infection, forming secretion and blocking the tube there, malforming stents in anyone who had been put on stent, clots blocking the passage, trauma damaging the ureter bilaterally, and ectopia. Post-renal causes could be as a result of trouble with the bladder, and in this case could be the cancer of the bladder, clot within the bladder, bladder dysfunction, posterior urethral valves, or bladder neck obstruction. Post-renal causes of renal failure could include urethral problem. In this case, urethra is expected to drain from the bladder outside, and benign prostatic hypertrophy could compress that. Also, prostatic carcinoma, stones could cause the block, and urethral stricture could be responsible. And finally, after listening to this presentation, you can also review acute kidney injury, acute urinary retention, already published, chronic kidney disease or end-stage renal disease, all published right there. I'm wishing all the affected people well. Remember to share this very presentation with your friends and colleagues. Remember to subscribe to my channel so that you can have all my presentations immediately they are published. I appreciate that.